Metabolic syndrome is a set of criteria that look at different components that set up an individual for risk for future cardiovascular disease. We've had a problem in our country over the last 15 years in particular of children gaining unhealthy weight, and I'm concerned about that because that sets up a lot of these children for a risk of developing disease later on in life. I have wanted to be able to tell which children are at greatest risk and also to be able to motivate them to make some changes to improve their risk. Our country in general, with the problems with overweight and obesity that we see in adolescents, we're going to see earlier type 2 diabetes and earlier heart disease among a lot of these children. The metabolic syndrome appears to manifest itself differently among certain racial ethnic groups and between men and women. And the score that we formulated is specific to each of those groups. So there are individual scores for both men and women and for different race ethnicities based on how the metabolic syndrome appears to manifest in those groups. What we'd really like is to be able to incorporate this metabolic syndrome severity score into the electronic medical record so that it's calculated automatically, and a physician seeing a patient who measures each of the components will be able to get that score and be able to communicate that to the patient and then follow it over time to look for improvements or to look for the response the patient has to different treatments. What we're really in this for is for improving patients' outcomes and for being able to find who's at risk, be able to follow their change in risk over time, and especially be able to motivate children and adults to making lifestyle changes so that they can improve their outcomes.